Welcome back to Grandma Needs Rehab. And in this episode, we talk about heat stroke. Why? Well, because it's hot. And unfortunately, it's also lethal. So if you ever wondered what the difference is between heat stroke and heat exhaustion, what the symptoms are, what it all means, well, stay tuned and we'll ponder that. As usual, we like to sit and talk about definitions of things, and particularly, what the medical definition of something actually means. Well, this is the definition of heat stroke. It is a severe heat-related injury involving body temperatures greater than, 104 degrees and causes central nervous system dysfunction as well as organ dysfunction and or damage. So, yeah, that's a lot, but we're going to explain what all that means. I think the easiest way to describe what that all means is that your body temperature, like your core body temperature, becomes so hot that it actually starts to cause damage to the noodle and unfortunately other organs as well, like kidneys and liver and skeletal muscles and things like that. And again, it's usually associated with a core temperature greater than 104 degrees. So we as providers like to think of heat stroke as basically two categories. There's the classic heat stroke, which is a person that's kind of out and about doing yard work, or they may be at the beach for, picnic day or whatever the case may be. They became overheated. People at a concert, people that don't realize that they're in an environment that's causing their core body temperature to go up. And then there's the exertional, which these are usually athletes or people in a marathon or people doing something like that, where they're scheduled to do something, run a race or whatever the case may be in heat and high humidity, and unfortunately can develop problems that way. Both categories, unfortunately, can cause the same type of symptoms, and both categories can be treated the same way and should actually be treated the same way, which kind of begs the difference as to why we have two categories. But there you go. For those that are super interested into actually why we do have two categories, there are some differences that we look for whenever people have classic versus exertional, particularly when it comes to exertional. For example, people that are marathon runners, not only can they be overheated, but they can have a lot of other electrolyte abnormalities, some which we'll talk about in a second. And some of those abnormalities need to be corrected quickly, but in maybe a different way. And we do look for certain types of electrolyte abnormalities and things like that that may be present in people that are, in a marathon race or exerting themselves very aggressively in high heat, as compared to somebody that was, at a beach just getting overheated and didn't know it. For heat stroke, there are some very specific symptoms, which is different than heat exhaustion. Heat exhaustion, we'll talk about in a second. But for heat stroke specifically, the symptoms that we really worry about are people that become overheated and start to develop things like confusion. These are people that were perfectly fine earlier and then become so hot that they become altered. Sometimes they have altered speech. Sometimes they're just confused as to where they are or who they are or what's happening around them. But confusion, unfortunately, is a big one. Ataxia, which is another way of saying off balance, is another big one. Ataxia is not just I stood up and got dizzy. It's somebody that's having a lot of trouble walking, usually associated with confusion. And they can have problems where they can't walk at all. Sometimes they walk and they just keep leaning to one side or the other, or they keep falling down. But confusion and ataxia, both very, very common, unfortunately, in heat stroke. Many times people can develop things like seizures, even if they've never had a seizure disorder. Seizures, unfortunately, very common, especially in the later stages or the higher degrees of heat stroke. So the three big ones that we notice, these two, confusion and ataxia, can sometimes be subtle and not exactly obvious, but with heat stroke, they become progressively worse as the temperature goes up or the amount of time that somebody has such a high temperature goes on. In other words, the longer your temperature is that high, the worse these things tend to be. And then, of course, seizures usually tend to be relatively obvious. While the symptoms such as confusion and dizziness and seizures like that, things tend to be more obvious on the outside. There's a lot of actual things going on the inside too that are also not so good when your temperature goes above 104, especially if it stays there for a period of time. Some of the things that we worry about are things like hypernatremia, which is just a fancy term for your sodium level goes up. And it's usually because of dehydration. As your body sweats and sweats to try and cool itself off, and it's not very effective, it continues to sweat. You lose a lot of salt, you lose a lot of water, and your sodium levels start to go up. Unfortunately, that can be significantly worse in people that have exertional heat stroke, which is one of the things that we look for, particularly in marathon runners and things like that. As their sodium levels become quite high, it can lead to other problems like swelling in the brain or cerebral edema. Unfortunately, not a good thing. That's one of the things, unfortunately, that can also lead to death, if not damage. But hypernatremia, not obvious because it's kind of happening underneath. Hyperkalemia, which is an elevated potassium. This is also common in heat stroke and unfortunately tends to be more common in people that have muscle breakdown, skeletal muscle breakdown, particularly marathon runners and athletes doing exertional things in very high heat. Again, one of the other reasons that we have a different category for them is that we look for things like hyperkalemia or elevated potassium. Unfortunately, elevated potassium is super dangerous and it in itself can be lethal if it gets to a certain level because the potassium, as it goes to levels above 6.5 and 7, can cause heart arrhythmias, or it can cause your heart to do funny or bad things that can unfortunately lead to death. So, yeah, hyperkalemia or elevated potassium also not so good. As we talk about muscle breakdown, again, can happen even for people that are not exertional or people that are not marathon runners or people at the beach that get really hot for a really long period of time. If they get heat stroke, they can have something else called rhabdomyolysis. I'm going to say rhabdo because it's hard to spell, but rhabdomyolysis is basically when your muscles break down, and your muscles break down because of the heat. That can actually release potassium into your bloodstream and make the hyperkalemia or high blood potassium levels actually worse. But this actually can cause muscle damage, and the muscle damage can be severe. And as your muscle breaks down and all those proteins get released into your bloodstream, then they have to be filtered out by your kidneys, which unfortunately can lead to something else, which is kidney failure. Kidney failure not only can happen because your muscles break down and kind of clog up the kidneys, but severe dehydration and low blood flow to the kidneys because of that dehydration can also injure kidneys. So you've got kidney injury because of the heat, you've got kidney injury because of low blood flow to the kidney because you're dehydrated, and then unfortunately your muscles break down and plug up the kidneys, and then we have just more problems. If all of those things weren't particularly bad enough or enough to cause death, which they are, but if you needed something else to explain why somebody else could die from heat stroke, there is other issues. One of them being something called endothelial damage. And endothelial damage is basically damage to the blood vessels and the lining of the blood vessels themselves. For example, if your blood vessel looked like that, which it doesn't, but if it did, um, the heat can actually cause damage to these little areas of your lining to the blood vessel. And when these areas of your blood vessel become damaged, then your body tries to fix them. And how does it fix them? It actually sends things to try and clot them and basically repair them. And that activates something called the coagulation cascade. All of that is just basically a nice way of saying that as the lining of your blood vessels becomes damaged because of the heat, your body turns on these little clots and little clots start to form. Ideally, they would form just to help repair these areas, but that's not what happens. You get these little blood clots that actually start to form and float downstream. And these little blood clots can get stuck in little arteries and things like that to the fingers and to the kidneys and unfortunately up in the noodle, and they can cause damage. And what makes it worse in severe cases is your body can start to form all of these clots at one time, and you can kind of use up all of the stuff that we need to make clots with because you just used them all. And then your body can start to bleed because we've made so many little clots here that are going downstream into other places that we don't have the proteins to make clots anymore. And then we start to bleed, and we can bleed through these little injured areas. And that is something called disseminated intravascular coagulation, in case you were super interested, which you're probably not, but it can definitely mess you up with little clots and then bleeding afterwards. This is very similar to actually what happens in sepsis, and that's why people can often die from like advanced stages of sepsis. So if you're interested in any of that, you can check out my sepsis video on the coagulation cascade and all the bad things associated with that. But unfortunately, this can be quite similar. So we've talked about all these bad things that can potentially happen that unfortunately each one of them could potentially cause death. But when you put them all together, you can understand how people with severe heat stroke die. So how do you stop it? Well, the big thing is to remember what the major symptoms are. Again, confusion, people that have ataxia, people that obviously have seizures out in the heat. They used to talk about people that don't sweat. Like for example, if you're sweating and you don't sweat anymore or you stop sweating, that could be a sign of heat stroke. It's actually not a sign of heat stroke, but what it is a sign of your body not being able to cope with the heat. It's not able to efficiently cool down, and that could be leading to heat stroke. So not sweating by itself is not a sign of heat stroke. And in fact, many marathon runners and the athletes that exert themselves during high intensity heat, unfortunately, they could be sweating profusely and still develop heat stroke. The reason it's so important to identify kind of what's going on with somebody, or you think that may be developing heat stroke or heat exhaustion, which we'll talk about in a second. The reason it's so important is because that cascade of bad things that can potentially happen to you, the sooner we get you cooled down, the less chance that those things will continue and less chance for those things to progress, because unfortunately the damage associated with heat stroke can actually last for weeks to months. Some studies say up to a year. For example, for your kidney failure to completely resolve, for some of the damage to the brain and the proteins and the injury to the blood vessels, the skeletal muscle issues, it can take weeks to months for people to recover from that. So the sooner we get someone cooled down, the better chance that they have of a recovery, not to mention a speedier recovery, because unfortunately prolonged heat stroke, even if you survive, many of those problems that we talked about earlier with skeletal muscle failure, kidney failure, heart arrhythmias, all this, some of that stuff can unfortunately be permanent. So the way you fix somebody with suspected heat stroke or somebody that you know is exhibiting signs of heat stroke is you got to cool them down. Not to be obvious, but that's exactly it. And you need to cool them down like super fast. The way it's actually recommended is to take that person and dunk them in a vat of ice water, because the goal when somebody has heat stroke is you need to get their temperature below 104. Actually, 103 is the goal to get somebody to a specific temperature. So dunk them in ice water. For people that don't have an ability to dunk them somewhere, they recommend ice packs under the arms and in the groin, all over you actually. But the big blood vessels in the armpits and the big blood vessels in the groin, they can absorb some of that cooler moisture or that cooler air. Basically, they can cool down faster. But you want to get somebody on ice as soon as possible to get their rectal temperature to 103, which is kind of interesting because most of us don't carry around, rectal thermometers. But to truly diagnose heat stroke, you need a rectal temperature, and a rectal temperature will determine if that temperature is above 104 rectally, that's with symptoms, is considered heat stroke. If your temperature is less than 104, usually 103 or less, that's one of the determining factors for things like heat exhaustion. But most of us don't carry those around, so you need to put that person in ice water as soon as possible. Most studies show that you need to cool that person down even before you transport them. So when you call ambulance 911, you're actually cooling somebody down with ice water, throw water, anything that you can to cool them down, because you want to get that temperature to 103 degrees or less, even before you get them to the emergency room if possible. If that's heat stroke, then what's heat exhaustion? Well, heat exhaustion is kind of a precursor to heat stroke. So it's when people are overheated, but they haven't quite reached that threshold where they start to have the neurologic symptoms. And it's usually associated with a lower core body temperature. It does have similar symptoms. For example, it can cause fatigue. It can also cause dizziness, often associated with a headache. And also, when people become overheated, they also tend to have an elevated heart rate, which can also lead to palpitations. These often occur before heat stroke does, but at the same time, people with heat stroke, because of the confusion and the effects it has on the brain, unfortunately, they usually don't talk about I'm fatigued, I'm dizzy, I'm having palpitations, because they're too confused. They are markedly confused. It's very difficult to get straight answers from them as far as what's happening because of the effects on their brain. But heat exhaustion, fatigue, dizziness, headache, palpitations, a lot of these occur at the same time. So people may be having kind of all of those things. The difference between heat stroke and heat exhaustion in the big picture is that their temperatures tend to be less than 104. Matter of fact, with heat exhaustion, most people have a temperature less than 103, but definitely less than 104, which seems to be the magic number when we start talking about the damage that starts to occur with brain tissue, with skeletal muscle tissue, and all of the other bad things. But less than 104, often associated with all of those symptoms. Some people have just a couple, some people have all. And again, ideally, to properly diagnose it, you would normally have a rectal thermometer to determine that the person's temperature is less than 104. But since we don't carry those, I think that's kind of easier to look for and less invasive for people that you don't know. Ideally, the recognition of heat exhaustion is very important because this, unfortunately, as we talked about before, can lead into heat stroke, and sometimes it doesn't take very long. Some studies show that people can progress from heat exhaustion symptoms into heat stroke within 30 minutes to 60 minutes. That's not a whole lot of time. So from the time people start developing some of these symptoms, you need to cool them down, and you cool them down the same way you do with heat stroke. You need to get them in some environment, particularly ice water, very cold water, something like that, getting them inside and dousing them with water while they're in air conditioning, anything to get that temperature down. And because their temperatures are less than 104, usually less than 103, those people do tend to cool down a tad bit faster, preventing progression to full-blown heat stroke. Heat exhaustion usually by definition does not lead to organ damage. So you don't see brain damage, you don't see kidney damage, you don't see musculoskeletal damage, which is one of the important factors to try and get these people cooled down before those things actually happen. And two symptoms that I did forget to talk about are things like nausea and vomiting, which we actually consider basically one symptom, but nausea and vomiting is also very common with people that start to develop heat exhaustion, but have not progressed to heat stroke. The other is muscle cramping, which again can be associated with dehydration and high temperatures, even before they turn into heat stroke. So heat exhaustion definitely associated with the muscle cramps as well. So I hope this explained a little bit about the differences between heat exhaustion and heat stroke and why heat stroke is such a big deal. So we need to stay cool. If you're out in the heat and you're doing things, make sure you hydrate, make sure you go in every so often, make sure you cool down a tad just to get out of the heat as best you can, and look out for friends and relatives and loved ones and grandma down the street or the people that you don't even know that well. If they start to exhibit some of these symptoms, just be aware of them so you might save a life someday. So for those who are worried about grandma, well, yeah, she's good. She had a little bit of heat stroke technically, but she's going to recover fine in rehab and hopefully stop gardening in 102-degree weather. But yeah, that's grandma. So if you like this kind of content where we sit and talk about medical stuff and kind of explain a little bit about what's what and why we do the things we do and what we look for, then subscribe, like, make a comment or two, and hopefully by the time grandma gets out of rehab, I'll get you another video.